Oh, we're live.
Hey guys, it's Elizabeth at Dr. Emer's practice, and I am here with our lovely patient Gordon, who is exactly 1 week post, let's see, Gordon, it was post Fraxel, post Erbium,
Fractora, and microneedling with PRP subsides.
So he definitely got the works. It was an aggressive treatment. We pushed the boundaries with Gordon's skin, but Gordon is the perfect Fitzpatrick for us to do that with. And so to help Gordon with the healing process, because he did have some swelling, he had a lot of irritation, skin sensitivity, and a buildup of dead skin, we have done one post-procedure facial, which includes an infusion of oxygen and gently helping to remove as much dead skin as possible, as well as a post-crystal fiber mask, post-treatment crystal fiber mask under LED. So he is 1 week post, and if you want to zoom in so that we can see how his skin is healing, his skin is healing beautifully. Around his mouth, he has some irritation, and he also has a buildup of dead skin. We also treated his neck area, and you can definitely see that he also has some dead skin there. So we're going to start by using the RestorSea Pro Foaming Cleanser, and the reason why I like to use this is because this has hydrolyzed salmon roe in it, which actually helps to gently exfoliate any dead skin. So what a lot of people don't know is that when you are using the RestorSea Pro Foaming Cleanser, you want to make sure that you're using it on dry skin, and then you incorporate the water to make sure that it exfoliates thoroughly. So this should be gentle. It's definitely one of my favorite cleansers to use at home. How does it feel, Gordon?
Feels very nice.
Is it irritating at all?
No, not really.
Okay, good. So we're using the RestorSea Pro Foaming Cleanser to gently exfoliate any dead skin without me pulling it. We never want you to pull or peel at dead skin because that could lead to post-inflammatory hyperpigmentation on the skin. So we're going to do just one gentle pass. And this is the beginning of the post-procedure facial. We like to recommend the post-procedure facial after any laser, ablative, or non-ablative, as well as fillers. So as you can see, it's starting removing the dead skin without me being too abrasive on the skin. His skin is very sensitive as it's still going through the healing process. So I'm just going to gently wipe off as much dead skin as possible and the cleanser. And then we'll go straight into our vitamin and mineral oxygen infusion. So Gordon is exactly 1 week post-treatment, and this is his second post-procedure facial. I always recommend this for anyone that's going through the downtime for the first time. It can be a little bit more intense than anyone anticipates. Gordon, do you think this was a little bit more intense than what you thought it would be? The healing process?
Oh, well, yeah, because he did it more, he did it stronger than the last time.
Yeah, Dr. Emer was a little bit more aggressive on Gordon's skin this time, so we wanted to make sure that we were able to minimize the down healing and soothing the skin.
I did the first one 3 days ago.
3 days ago, yeah. So the first post-procedure facial was 3 days ago. So the first step in the post-procedure facial is always salmon roe to gently exfoliate the skin without causing any major irritation. Now the next step is going to be our oxygen infusion combined with vitamins and minerals. So we are going to gently put oxygen on his skin, and this is going to help his skin heal a lot faster. It's going to feel very soothing, very hydrating, and this is here to push minerals and vitamins deeper into the skin.
Feels so good.
Yay, good. So a lot of our patients love this part of the treatment because as they're going through the downtime, their skin is feeling very, very dry and dehydrated, and this helps to hydrate it. How is it feeling, Gordon?
Feels very hydrating.
Yeah.
And it smells good. So.
It does smell good. It's very hydrating and soothing. So the oxygen helps to heal the skin faster. The minerals and vitamins give the skin the nutrients that it needs in order for the skin to heal fully.
My skin was, before this, my skin was feeling really warm, but this is making it feeling a lot cool. I mean,
Cooler?
cooling effect, so it's feeling
Good. So by using oxygen and minerals, we are helping the skin to heal faster, but we're also helping it so that the new skin that comes up from underneath is as healthy and vibrant as possible. I absolutely love these treatments. Do we have any questions?
Not so far.
Nice. Is everyone still sleeping on a Monday morning? All right, so this is the second step of our post-procedure facial. Gordon had a very aggressive treatment done a week ago. He had multiple lasers as well as microneedling with radio frequency done. And his downtime was a little bit intense. So in order to help minimize the sensitivity and the discomfort after the treatment, we always offer the post-procedure facials to help the skin heal and soothe a lot faster. So this is a very hydrating, soothing treatment. We don't cause any major irritation to the skin. We want to make sure that we're giving it a lot of TLC.
What oxygen machine is this? Which serums and products are used?
Okay, so the first product that I used was the RestorSea Pro Foaming Cleanser. This is our Echo 2 Plus oxygen machine, and the vitamins and minerals are proprietary. I can't give all my secrets away, guys. We use our own blends, and we want to make sure that we're using a lot of arnica extract. That's a big one for us, as well as chamomile extract to help the skin soothe and stay hydrated.
So how much was the downtime?
Well, my treatment was more intense than usual, but my skin is also used to it because I've done multiple treatments. But this downtime has been a little bit longer.
It has. So normally, Gordon, what would you say your normal downtime is post-treatment?
My normal downtime is about 4 days.
About 4 days, and this is a week post.
Yeah.
So you're seeing that Dr. Emer definitely pushed it a little bit with Gordon's skin, but that is how Dr. Emer is able to achieve amazing results. And as estheticians, our job is to make sure that your skin is healing along the way and making sure that it's soothed and that the new skin that's coming in after all of this treatment and after all of the downtime is possible. So that is facial to all of our patients after lasers. They are very healing and soothing. So this is exactly 7 days after. And as we stated, Gordon got the works. Right, Gordon?
Did you do RF with an Erbium laser and then PRP on top?
I'm sorry?
What was the question?
The erbium?
Was erbium done?
Did you do RF with an Erbium laser and then PRP on top?
Radio frequency?
Yeah.
What is that?
Fractora?
Fractora.
Oh, yeah, he did the Fractora.
Right, so he did Fractora, and then after that, he did microneedling with PRP on top of it. All right, Gordon, how is your skin feeling?
Feeling a lot more hydrated.
Good. And you can see that we were able to remove some dead skin, especially around his nose. His forehead, he had a little bit of dead skin, but look at how much more soothed it is around his mouth. That was the area very irritated, and it looked very sensitive. So we want to make sure that we target that. Now the final step in our post-procedure facial is going to be one of my favorite masks. Let me grab it. It's called the post-procedure crystal fiber mask. One sec. Okay, I like to keep these in my little freezer. So the post-procedure crystal fiber masks are my favorite because they're highly saturated in hyaluronic acid as well as platinum powders. Platinum powders are very anti-inflammatory to the skin. So this is the perfect treatment post-procedure. And that's why it's called the post-procedure crystal fiber mask. It's very cold, it's very soothing and hydrating. All right, Gordon, this is gonna feel a little bit cold, okay? I'm sure that'll be nice for you. All right. So I like to recommend this mask for anyone. You can use these at home, and I like to recommend that you put them in the refrigerator so that they're very cold and hydrating and soothing. How does it feel, Gordon?
Feels good.
Good. So what I'm going to do is I'm just going to put some of the serum that is left behind. I'm going to put it on his neck to help. Now his neck is not as irritated as it was last week, which is great. We just want to make sure we keep it hydrated. All right. Is your neck feeling hot, Gordon?
Not really, no.
Okay. All right, so now I'm going to put some goggles on Gordon, and then we're going to put the LED on. Now the LED is also going to be very anti-inflammatory. It's going to be soothing and hydrating. Well, it's going to help push in the nutrients, so it's going to soothe the skin a lot. And combined with the crystal fiber mask, it's going to be a very hydrating treatment for Gordon. So let's go ahead and put on the light.
What is PRP used for?
PRP is used for a lot of things. We like to use it to help regenerate the skin very quickly. All right, Gordon, is that comfortable for you?
Mm-hmm.
All right. So PRP is going to help regenerate the skin. It's going to help minimize the downtime. It's also going to give the skin nutrients. We keep talking about this concept. We want to make sure that the skin has all of the nutrients that it needs in order for it to be as healthy as possible as it's healing. So not only do we care about the treatment itself, but we also care about delivering nutrients to the skin so that your skin heals and so that your skin is glowing once you're done with the downtime. So we're going to go ahead and leave the light stem on. We're going to leave our LED on Gordon, and this is just going to help with the product and the inflammation, and we're going to see you guys back in 10 minutes.